Hello everyone, this is Beth Gregg from Wyndemere Residential Health Services. I will be talking to you today about a very important topic, emergency procedures and preparedness. We have four main subjects that we'll be discussing: active shooters, fire, weather, and medical emergencies. We'll be starting with a discussion about active shooters. An active shooter is an individual actively engaged in killing or attempting to kill people in a confined and populated area. In most cases, active shooters use firearms, and there is no pattern or method to their selection of victims. Active shooter situations are unpredictable and evolve quickly. Typically, the immediate deployment of law enforcement is required to stop the shooting and mitigate harm to victims. Because active shooter situations are often over within 10 to 15 minutes before law enforcement arrives on the scene, individuals must be prepared, both mentally and physically, to deal with an active shooter situation. How to respond when an active shooter is in your vicinity. Quickly determine the most reasonable way to protect your own life. Here are some guidelines to help you quickly determine your best option to protect your own life in the event of an active shooter. The optimal thing to do is to run. Be sure to have an escape route and plan in mind. Plan ahead. Evacuate regardless of whether others agree to follow. Leave your belongings behind. Help others escape if possible. Prevent individuals from entering an area where the active shooter may be. Keep your hands visible and follow instructions of any police officers. Do not attempt to move wounded people. And be sure to call 911 as soon as you can when you are safe, even if you know other people are calling 911 as well. If evacuation is not possible, then you are going to want to hide. Find a place to hide where the active shooter is less likely to find you. Your hiding place should be out of the active shooter's view, and it should provide protection if shots are fired in your direction. It should not trap you or restrict your options for movement. To prevent an active shooter from entering your hiding place, lock the door and blockade the door with heavy furniture. If you know the active shooter is nearby, be sure to lock your door, silence your cell phone, turn off any source of noise like radios and televisions. Hide behind large items like cabinets or desks. Remain quiet if evacuation and hiding out are not possible. Remain calm. Dial 911 if possible to alert police to the active shooter's location. If you cannot speak, leave the line open and allow the dispatcher to listen. And as a last resort, fight. Only fight when your life is in imminent danger. You can attempt to disrupt and/or incapacitate the active shooter by acting as aggressively as possible against him or her, throwing items and improvising weapons, yelling, and be sure to commit to your actions. How should you react when law enforcement arrives? Remain calm and follow the officer's instructions. Put down any items in your hands, like bags or jackets. Immediately raise your hands and spread fingers, and keep your hands visible at all times. Avoid making quick movements towards officers, such as holding on to them for safety. Avoid pointing, screaming, or yelling. Do not stop to ask officers for help or direction when evacuating. Just proceed to the direction from which the officers are entering the premises. It's also important to keep an eye out for suspicious activity. You're going to need to watch for the following situations. A strange object is found in an unusual place. A person is behaving strangely or inappropriately. Or your gut feeling is that there is something wrong. If you see something suspicious, call 911. Always err on the side of caution. These are some questions that you might be asked in reporting suspicious activity. Who did you see? What did you see? When did you see it? Where did it occur? And why do you feel it's suspicious? We're going to talk now about fire procedures here at Wyndemere, what to do in your apartment and out in the community if there is a fire. If you hear the fire alarm when you're in your home, stay where you are until the alarm stops or until further directions are given. We have a shelter in place policy. Do not open your door. Do not call the front desk unless you require immediate assistance. If you hear the fire alarm while in a common area, stay put until the alarm stops or until further direction is given. Close all open doors. Here are some tips to follow when you see a fire. If the fire is in your home, leave immediately. Do not attempt to fight the fire. Close the front door behind you. Pull the nearest fire alarm. Proceed to the front desk and remain until the fire department arrives. If you set off the smoke alarm due to cooking smoke and there is no fire, do not open the front door. Open the patio door and windows to clear out the smoke. If you are in a common area and discover a fire, evacuate away from the fire via the fire doors and pull the nearest fire alarm. Leave the building using the closest exit. Do not use elevators. If you cannot walk downstairs, wait on the landing of the stairway for further assistance. Check the safety of a fire door before opening. If the fire door is hot or if smoke is detected, do not open the door. Evacuate in the other direction. There are many fire extinguishers that can be used at Wyndemere, and it's important to review how to use a fire extinguisher correctly. Remember the code word PASS, P-A-S-S. P stands for pull, pull the pin in the handle. A stands for aim, aim the nozzle at the base of the fire. S stands for squeeze, squeeze the lever slowly. And S stands for sweep, sweep from side to side. What should you do if your clothes catch fire? Stop, drop, and roll. You want to stop where you are, don't run, drop to the ground, cover your face with your hands, and roll over and over until the fire is out. Now we're going to spend some time talking about weather emergencies and power failures. Around here, we are prone to having tornado watches and tornado warnings, and it's important for you to know the differences between the two. Tornado watch is when conditions are favorable for the development of severe weather. They can be issued up to 6 hours in advance of severe storms. And a 2-word definition for your preparation is to be alert. You can listen to the radio or the news to keep track of what's going on with an upcoming storm. A tornado warning is when severe weather is forming, observed or detected by radar. It's issued a few minutes to 1 hour in advance of severe storms. And what you need to be aware of during a tornado warning is that you need to be ready to take action. You will have notifications sent to you from the One Call Now automatic telephone system letting you know when a tornado warning is in effect. If a tornado warning is issued, move to your bathroom or any public bathroom. Close the door. Stay away from windows and exterior doors. If you are on the ground floor, proceed to the resident storage area and await for further information. Please do not call the front desk unless assistance is needed. You will receive automatic phone notifications with information about tornado watches, warnings, and necessary procedures. But we do need to keep the phone lines at the front desk open for emergency purposes. How to prepare for a power failure. Make sure that you have several working flashlights in your apartment. Consider purchasing extra batteries in case a power outage is extended. Have a cellular phone for emergency use. Remember to charge it in anticipation of the storm. Using a car charger is an alternative way to continue to charge a cellular phone in the event of a power failure. You might also want to consider having a landline phone, but a cordless phone will not work during a power failure. Make sure that you keep enough prescription medications and medical supplies on hand. Do not wait until you have only 1 day's worth of medications before refilling a prescription. In the wintertime, prepare for a potential weather emergency by stocking extra blankets and warm clothing within reach. Keep your pathways clear in your apartment to help decrease the risk of a fall emergency during a power failure. In the event of a power failure, emergency pull cords will continue to work in your apartment. However, if you use an emergency call button such as CordMate, that unit will not be functional. Use cellular phone, corded phone, or a pull cord when needing emergency help. You will receive phone updates about the power failure. Avoid calling the front desk except for emergencies. If you use oxygen or nebulizers and staff have not contacted with you within 1 hour of the power failure, please call the front desk. Use your portable oxygen tanks while waiting for the concentrator to be connected to power. It's important that you're comfortable with knowing how to use your portable oxygen tanks, and you might want to consider practicing this in advance of a storm to be sure that you know how to do it correctly. In the event of a power failure, avoid opening your refrigerator excessively. After the power is restored, don't take a chance with your health related to potential spoiled food. When in doubt, throw it out. If you have medication that needs to be refrigerated, please bring it down to the kitchen in a bag clearly labeled with your name. If you use electric medical equipment such as oxygen, nebulizers, electric recliners, CPAP machines, motorized wheelchairs, or hospital beds, please let Residential Health Services know as soon as you can. We want to make sure that we can help support your needs in the event of a power failure or weather emergency. If a storm is coming, we recommend that you do not sleep in an electric recliner chair. In the event of a power emergency, it will be very difficult for you to get out of the chair safely. We will talk now about medical emergencies. We will talk first about what to do if you find an unresponsive person. Attempt to wake the victim. If the victim is not breathing, or if they're gasping for breath or does not respond to stimuli, call 911. If someone is there to help, one of you should call 911 while the other moves to start chest compressions. Make sure the second person also goes to get the AED and return with it as soon as possible. Keep 911 on the line so they can coach you through the CPR process. Check the left wrist of the victim to see if there is a Do Not Resuscitate DNR bracelet. If there is, you do not start chest compressions or use the AED. If there is any doubt about whether the person has a DNR bracelet, go ahead and start CPR. Begin chest compressions. Place the heel of your hand in the middle of the chest. Put your other hand on top of the first with your fingers interlaced. Compress the chest at least 2 inches. Allow the chest to completely recoil before the next compression. Compress the chest at a rate of at least 100 pushes per minute. Keep going until the paramedics arrive or the AED is brought to the scene. How to use an AED, otherwise known as an automated external defibrillator. Step 1. Get the AED to the scene. Turn it on by pressing the green on button. From there, the AED will give you verbal instructions and will also show you what to do on its computer screen. Once the AED has been turned on, it will tell you first to call 911 and then it will direct you to place the pads on the person. It will show you where to put the pads on the person. The AED will be analyzing that person's heart, and it will be determining if a shock is needed. At some point, the machine will tell you, do not touch the patient. It's analyzing the rhythm to make this decision. If a shock is advised, it will tell you not to touch the patient while you're pushing the shock button. People get concerned about using an AED because they worry that they could use it incorrectly and that a shock might be given to somebody who shouldn't get one, but you can rest assured that the computer of the AED will not allow this to happen, and it will only deliver a shock if it is warranted. We have AEDs all over campus. We have one on the ground floor outside the coat room, on the first floor by the mail room, on the second floor by the center elevator, and on the third floor outside of the library. Residents, employees, and visitors may use the AED in emergency situations. Please notify the front desk at Wyndemere if you do use the AED. Continue following the directions on the AED until help arrives. If the victim wakes up, you can go ahead and stop CPR, but keep the AED in place until the paramedics get there. Here is a list of emergency symptoms. Call 911 immediately if you're having chest pain, shortness of breath, severe pain, bleeding that does not stop, head or spine injury, sudden difficulty breathing, sudden difficulty talking or walking, sudden loss of movement on one side of the body, sudden severe headache, sudden change in mental status, any fall where you need assistance getting up, fainting or loss of consciousness, coughing up or vomiting blood, persistent vomiting or diarrhea, or severe dizziness. If you're having a medical emergency, call 911 directly. Doing so decreases the response time for the 911 team and gets help to you faster. Then, if possible, notify the front desk at Wyndemere that you have called for the paramedics. If you are unable to call 911 yourself, please activate your emergency pull cord. This will alert the front desk at Wyndemere to call you. You will be asked if you have called 911 and for details of your emergency. Then a resident assistant from Westbridge or a security officer will be dispatched to your home to wait with you until the paramedics come. If the front desk attendant calls your apartment and you are unable to answer this phone call, a residential assistant or security officer will be dispatched to your home. The staff has a master key that they will use to gain access to your room if it is locked. From there, they will help call 911 for you. The paramedics will be provided a copy of your emergency medical data sheet by the front desk attendant. If you have medication or health information changes that happen through the year, please notify RHS so we can keep your forms updated. If you are taken out by ambulance to go to the emergency room, the front desk attendant will make every attempt to reach one of your emergency contacts to notify them of your transfer and to provide information about how to contact the emergency room for further information. We recommend that you prepare yourself for any emergencies by keeping supplies on hand, including a first aid manual, bandages of different sizes, gauze of different sizes, ACE wraps, tape, tweezers, nail clippers, scissors, antiseptic wipes, instant cold compresses, disposable gloves, bottled water, canned food, battery-powered radio and a battery-powered fan, spare batteries, safety pins, flashlight, blanket and warm clothes, Tylenol, ibuprofen, Benadryl, hydrocortisone cream, antibiotic cream, hydrogen peroxide, a thermometer, cough and cold medicine, Imodium, and Pedialyte. If you have any questions about the information that was provided in this presentation, please see Steve Schultz in Facility Services or Beth Grigg in Wyndemere Residential Health Services for more information. Thank you for listening to this information, and we hope you found it valuable.